Hello, everyone. Good afternoon. Thank you for joining the Maryland Center of Excellence today on problem gambling for a webinar to celebrate May is Women's Health Month. And my name is Heather Eshelman. I'm the prevention manager at the center. I'm going to go over some housekeeping notes for you, and hopefully they'll be clear and you'll be able to do your post test and be able to get your 1 hour credit CEU. So you will be awarded 1 hour CEU for attending today's webinar. Please note, no CEUs will be given to attendees listening on audio only. You must be online and linked into GoToWebinar. Approximately 1 hour after the webinar concludes, you will receive an email with the webinar post-quiz evaluation link from GoToWebinar. Cut and paste the link into your web browser. Once you complete the post-quiz evaluation, the certificate of attendance will be emailed to you from the center within 2 to 3 business days. Due to the number of attendees on today's webinar, we will keep the audience muted. If you do have any questions during this webinar, please use the question function. We will be monitoring the questions during the webinar and will respond back to you and all the attendees in real time. Please join us for our next webinar on Friday, May 28th. Don't forget about the power of the unconscious, a spectrodynamic approach to working with problem gamblers, presented by Anthony Parente. Visit the center's website, mdproblemgambling.com, to register. And do mark your calendars on Friday, June 25th for the 8th annual Maryland Virtual Conference on Problem Gambling. So I want to make sure you heard that. We are running our conference this year. It will be June 25th, and it will be virtual. So registration will go live at the end of May, and we hope you can join us for that. For more information on our training programs, please contact Donna Gaspar at training@mdproblemgambling.com. All right, thank you, everyone, and we will go ahead and get started on today's webinar. So what we are going to cover today, I was able to pull the research and data on women's gambling, just so you'll have a good background on what the scope of gambling looks like for women here in Maryland, as well as nationally and internationally, and also what does problem gambling look like for women. And then women's gambling behaviors and how they are different from men. There are quite a few differences, and you will see those throughout this webinar. So I found it very interesting as I was pulling this webinar together, what the differences were. And then what, as health professionals or behavioral health professionals and family members, that you can do to support safe gambling behaviors among women, and just to have that conversation with the women in your life, whether you serve them or they're your family, how you can talk to them about this important topic. And then also how we can prevent gambling problems among women. And finally, I hope to leave a few minutes at the end if there are any questions. So this is a new graphic that Donna Gaspar, our communication manager, has developed. And I won't go through all of these things that we do, but this is basically an overview of what we do at the Maryland Center of Excellence on Problem Gambling. And as you can see there in the center circle, our mission is to promote healthy and informed choices regarding gambling and problem gambling to all Maryland residents. So we do a lot of public awareness campaigns, and hopefully you've been able to see and hear some of those on the radio and TV, as well as participate in some of our webinars and trainings. We also do provide help and hope for those with gambling problems. So we have our helpline, 1-800-GAMBLER, as well as our peer recovery support program. And also, I think the hottest topic that we all have been aware of over the last few months is sports betting. So that legislation passed a few weeks ago, and so now they are working on the regulations for sports betting. So we hope to keep you all updated on how that all unfolds. So gambling behaviors in women, what data do we currently have? So if we look at the Maryland problem gambling prevalence study that was done in 2017, we are currently, our research department, Dr. Tracy and her staff are working on a new prevalence study, and hopefully that report will be out soon, and we'll be able to provide even more updated data for you. But according to our last prevalence study, as you can see, gambling is very prevalent and common in our society. So if we look at the difference between the number of males and females ever reporting gambling in their lifetime, 90% of males, and this is over 18, and 85% of females reported gambling in their lifetime. And then as we look at our frequent gamblers, so that would be defined as gamblers that gamble at least weekly. As you can see, there is a drop in the number of in the percentage of females that gamble weekly. So we can say that, you know, males are more likely to be frequent gamblers than females here in the state of Maryland. And with that, of course, comes risk, because as people gamble more frequently, they're kind of more likely for that to spiral out of control and either spend way too much time or way too much money. But this is the data here on frequency. And then as we look at our disordered gamblers, so those with gambling disorder are more likely to be male. So about 3% of our Maryland adult population would be a disordered gambler for our males. But as you can see, for females, it is lower. So about a little over 1 in 100 female adults here in Maryland would be a disordered gambler. So I'm shifting here a little bit on you to another data source. So this is the Youth Risk Behavior Survey, which is done here in our Maryland high schools, and it looks at our high school students. And fortunately, we were able to include a question in the most recent survey, which was done in 2018. So we don't have any trend data yet on this because this was the first year it was done. But as you can see again, the frequency or the percentage of youth reporting gambling activities is higher among males here in the state of Maryland compared to females. If we look at the total of all high school students, about 22% of students, high school students, reported gambling in the last year. Now this slide is showing the same data pretty much, but by gender. So as we look at the number or the percentage of male high school students that are reporting gambling in the last year, as you can see, the range goes to about 40%, all the way down to the Washington County percentage. And so it goes down into, you know, the teens percentage there. So Baltimore City is the highest, and so that's where, you know, we'd like to tailor activities to areas that are of greatest need. Then we look at the female data for the same survey, the Youth Risk Behavior Survey. So the number of female percentages for each county is a lot less than the male percentages. So We know that our Maryland female high school students are gambling a lot less than the males, but it's still of concern, as you know, Baltimore City still has 17%. And as we look at high school students, it is underage gambling, so it's not legal for them to gamble either at a casino or through lottery. So it is of concern that so many high school students are engaged in an activity that is illegal. So this is helpline calls by gender. So this is for the last about 8 years. So what we did here was we took the percentage of calls and looked at whether they were female or male callers. So if you look at FY13, 48% of the calls were from males and 52% were from females. So it was pretty close back then, the amount of calls we were receiving. But if you look over time, the percentage of males calling has increased. Now, we haven't done any studies or anything to see why this would be the case, but it could be to increase promotion. It could be that males are feeling more comfortable to seek help. It could be for a lot of reasons. But for in general, we're seeing more males call here in Maryland compared to women. And finally, for the data points, this is data from the Maryland Lottery on the voluntary exclusion program. So basically, if someone wants to exclude themselves from participating in gambling activities, either through casino, lottery, or bingo halls, they can put themselves on a list, and then they are not able to participate in those type of gambling activities. So here you can see that the voluntary exclusion program, the blue bar is casino and the red line is lottery. So for both types of voluntary exclusion programs, males dominate on those lists. So as we get into women and gambling, I was starting to look into just if there were any famous celebrities that had gambling problems. And if you Google it, you'll find some of the same people that I found. But Gladys Knight, I really love her music, so I had to put her here today. And she's also a story of recovery. So that's always something we want to highlight. So she started to gamble oftentimes after she would do shows. She would be in these hotels that had casinos. And so her friends would ask her to go gambling with her, and she started to enjoy playing blackjack at the casinos. So it started to escalate into a problem for her. At one point, she lost like $40,000 in one night. And so she started to realize that she had a gambling problem. So as it says here, she actually called Gamblers Anonymous and went right away to start on her path to recovery. So I think that Gladys Knight is an inspiration, and I feel like she would be someone that you might look at and say, I can't believe she has a gambling problem. She just looks so beautiful and just peaceful. But it goes to show you that that gambling can hook women, men, people of various backgrounds, and it's not something you can see on the outside. So anyway, she wrote a book, her biography, and she has a lot more detail in the book. So if you're interested, you can find her biography. And just in case you all didn't see this article that was in the Baltimore Sun about a month ago, I know us in the office, we thought it was pretty well written. It talks about how an older woman who was on the voluntary exclusion program had been, suffering during the pandemic. She was lonely and, depressed and upset at the loss of her husband. And she went back into the casino, and then they didn't catch her right away, but she gambled and then, was caught when she won something. So she ended up getting, charged with criminal trespass. So this whole article was about how, you know, painted a picture of gamblers and how they, you know, are on the list, but they aren't always caught right away. It's just a very interesting story. So, and it also talks a lot about how the coronavirus has impacted gambling as a whole. So I encourage you to read this article if you haven't already. So let's start to look at the differences between women and men and their gambling behaviors. So why do women gamble as a whole? And some of them are the same as men, but some of them are different. And I didn't always cite the source in some of these because they kept coming up over and over again, the same things, which is a good thing. So women often gamble because they're looking for excitement. They see it as something they can do socially with their friends or coworkers after work, and it's fun. And they're just drawn to like, they feel like casinos are classy and upscale and glamorous, and there's a pool, you know, draws them in to participate in an activity. So we can all, any of us that have been in a casino can agree that is definitely an exciting type of environment. So that pulls women in oftentimes, more so than it might for men. A second thing would be wanting to escape. So women have a lot of stress in their daily life, and we need coping strategies. Some could be positive, some could be negative. And with gambling, we won't necessarily say that's positive or negative. It's risky, but it could work for some people to be a safe outlet for coping with stress. So, but it does provide a good escape for people. I think of it oftentimes as like if you're going to watch a popular movie, you kind of get lost in that movie and the characters and the action of it and the story. So that can happen too, you know, as people enter casinos or they're participating in other gambling activities. It just provides an escape from the everyday stress. And then also, we are aware that oftentimes women do suffer from abuse, whether it be domestic violence or they could have been, you know, maltreated as a child, child abuse. And then there's also lots of trauma. So people, sometimes women, especially because they're more likely to be abused and suffer abuse, have been would use gambling to cope with those things. And that one of the reasons for that is that gambling allows women and others that are in trauma and abuse to kind of tune out and zone out. So these are the most popular reasons I saw why women would be attracted to gambling. So as we look at women and in their stages of life, we can look at how does gambling impact age ranges of girls and women over the years. So you're listening to a woman who has, well, actually my daughter will be 11 next week. So I have a preteen who really keeps me on the radar with what's kind of up and coming. But you know, there's definitely girls, young girls, preteens, teens may often see their parents gambling, which could, you know, normalize it for them, and it may be something that they think an adult will do and something they strive to do. They are definitely exposed to ads just as much as adults are. So the billboards on the side of 95 advertising different types of gambling. And also with our girls, there's so much on their devices as far as tablets and cell phones. And there's tons of pop-up ads for games. And some of them may include gambling or just putting in, you know, money to get virtual coins. So it kind of trains the mind to be attracted to gambling games. So you know, we have a whole other presentations on youth and how gaming to gambling can be a risk for them. but it's just something to be aware of here as we look at girls becoming women. And, girls have been super impacted by COVID, by not being able to go to school and having their normal social outlets. So I can tell you my daughter's been on her tablet more than I would like, and we're cutting back on it, but it's it's just a reality in today's world. So then when we look at our young women, say around the age of college age, they're now legal to, they can gamble legally if they would like. And I saw a really good article on the young women in college age, and they're often influenced by their peers. So if their peers gamble, of course, they're more likely to gamble. And if their friends start going to the casino or doing online gambling, then they're more likely to do it too and be exposed to it. And then there's also college parties. A lot of times there's poker games and gambling going on. So that is kind of where we see, young women engaging in gambling activities. And then when you look at middle-aged women, and I can really speak clearly to this point, because we're kind of in this sandwich generation, where we're trying to work a full-time job, raise our families, and take care of aging parents. So we are definitely looking for good coping strategies and stress relief. So that's where I think, some of the common reasons why women, maybe in my age group, in their 40s and 50s, would be drawn to gambling. And then older adults have become of greater concern. And I did see a lot of articles on our older adults because as you see, you can think of them, oftentimes they physically have limitations. So they're not able to engage in as much physical activity as they used to. Gambling can be done by anyone, even if they have disabilities. So it's appealing to older adults, and they're also, coping with loss or in transitions of life. So that does put our older adults at risk for gambling problems. Anybody at any age could be at risk of a gambling problem, but as our older adults are going through a lot of transition, I'm happy to say we've been doing more programming with the Maryland Department of Aging to get messages out about safe gambling practices and the help that's available for our older adult population. So just going on some other general differences between women and men and gambling behaviors. So there was quite a few studies that showed that women are more likely to start gambling online, and that the numbers are increasing of the number of women that gamble online. And that's appealing to women because some women don't really want to be in the public. They don't want to show that they're gambling. So it's easier to hide those type of activities. And then it's kind of a quick, again, there's lots of lights and sounds in these online gambling games. So, it can definitely be a way to distract women from whatever their, stressed out or daily life is. And then also, I'm going to show you some of the ads that I've found the last few days on how businesses use marketing to attract women to try to gamble. So there is a lot more advertising out there for promoting gambling to women. So they use celebrities and they use like glamorous and upscale lifestyles to kind of appeal to women to try to get them to gamble. Also, like I talked about earlier with the women that are older, women tend to live a little longer than men. And so, but they are actually more likely to start gambling at an older age compared to men. So men, I didn't really find any good numbers on it, but women would be more likely to start, say, after college versus young men who would do it even in high school and college. So you see women kind of starting gambling behaviors later in life. And then there was a lot in the literature about women using gambling to deal with anxiety and stress. And, you know, they just, I guess they don't really have any other outlets and are not perhaps aware of the risk of addiction with gambling. And also we can't treat all groups of women the same. Of course, we have minority populations, and you know, even the data here in Maryland shows that our minority populations are more likely to be problem gamblers. And in working with the Asian population, we know that Asians have a lot of gambling in their cultures. And so it is socially acceptable for Asian women to gamble. And African Americans, somewhat the same, but not, we see more Asian women gambling compared to African Americans. And then with the American Indians, they do have gambling on Indian reservations. So again, gambling is very normalized in the American Indian population. And we've already talked about older women. So, and if our older women are involved in their senior center, local senior center, some of the local senior centers before COVID were doing bus trips to the casino. So, which is fine. Again, we just want to promote safe gambling tips, but there is access to gambling for our older population. So one thing I found that was interesting, and this was more in relation to a study that was done of Asian women. And so for the immigrants that are coming from Asian countries, they said that they're likely to gamble and go to the casino because it helps them to fit into the new culture. And since there's casinos in the countries where they came from, it kind of made them feel at home. And even if you don't speak the language, you can go into a casino and play the slots or play games. You don't need to speak English to do that. So I found that was pretty interesting. And then again, just transitions in life. If someone is to get a divorce, or say they're an empty nester, their children go off to college, they're more, women in particular, are more likely to feel a little loneliness and start a new habit, which could possibly be gambling. And I can't say for sure because this study here on the Gamblers Anonymous, there's like this stereotype, or that, you know, Gamblers Anonymous are for men because it's mostly men that attend, so women aren't always comfortable going to Gamblers Anonymous. Now I'd like to get some updated data on that, because I think that that study had been done about 10 or 15 years ago, so I'd be curious to see if that's updated. And then also another interesting information found in the literature is that you know, women that are going to get help for gambling are more likely to say they are currently already in mental health treatment. And men are more likely, when they seek problem gambling treatment, to say that they have a drug problem or they've been arrested. So oftentimes the studies showed that women aren't often arrested if, you know, they're, like, say they have an embezzlement charge or a fraud charge because of gambling, they're less likely to be arrested for it compared to men. And so I found that interesting. And then also the women are more likely to seek help in general for mental health problems as well as gambling problems. And that's what that study showed. And it also showed that there's a high rate of suicides caused by gambling, and it was slightly higher for the women. So it was about 26% of women in that study said that they were suicidal because of their gambling. So that's something at the center we're always focused on, because we want to prevent and help people that are in crisis. So this was a list of the top online gambling games played by women. And the slot machines probably don't surprise people. So just like you can go to a casino, if you want to gamble online, there's plenty of games that are the slot type games with the same lights and sounds that you may find in the casinos, and themes as well. So that's accessible. Also, Keno, kind of picking the numbers, that's another thing that's found online that women engage in. And I wasn't aware that you could do scratch cards online, but if you, I guess you kind of scratch with a coin and virtually, and then you can win or lose on scratch cards also online. And then bingo, I think a lot of people are aware that bingo is a common and popular type of form of gambling for women, but it also can be done online. And then some women actually do engage in some of the skill card games. So blackjack and baccarat can be found also online. So these are all, this was kind of like a poll, I think, that was done by this online UnitedStatesCasino.com, and they showed which games were the most popular for American women. So I just wanted to show you some of the ads that are out there. And I just pulled these like this week, so they're on the websites. And this one, as you can see, this is for Maryland Live. And they are clearly targeting, men and women, and you have different diverse women there. And of course, they all look beautiful and they're dressed nice. And it just really does attract you to come to the casino and to participate. So ads really do have an impact on women and gambling. And then here's another one from the same Maryland Live website. So it just shows, come and dine here. Look how beautiful the food looks, and it's probably very delicious. And you got your fancy drinks, and the lady looks really dressed up and pretty, so it can draw women in to go to the casinos. And I didn't know this existed because I don't really go to casinos, but I wasn't aware that Maryland Live actually has a spa inside the casino. So I thought this ad, what else? If you like spas, this would probably draw you in to go to Maryland Live, because it looks like these women are having a very relaxing and fun time going to the spa. This was one that I found on Rocky Gap's webpage. So this is the casino in Western Maryland. And they were actually giving away handbags to come in there and to gamble. So I figure this really does appeal to women that like those really nice handbags. So I'm going to ask you real quick to put any answers in the chat. Have you seen any gambling ads targeting women? I'm just curious. And I know we have a large audience out there. It looks like we have over 100 people on the webinar, but Donna was going to pull a couple answers off. If you've seen any ads targeting women for gambling, if you could type them in the chat real quick and we'll read some of them out loud. And I appreciate your participation today.
Heather, our audience is busy typing right now. As we're waiting for more references and questions and comments to come in, we did have an earlier question from Paula. Has the center collected data by race?
So our research department has data on race, and like I said, they're getting ready to release another round of data. So we're really curious to see how that'll look. We haven't asked for a breakdown of women, by gender and by race. So as I was putting this webinar together, I thought that would be a good thing to ask our research department to put together. But yes, we do have data on race, and we're seeing, our minority populations are more likely to be disordered gamblers compared to the white population. And that is similar to data across the country. So we do want to put a lot of our prevention efforts into our minority populations and those at greater risk of problem gambling. So thank you for that question.
And Heather, we are getting a lot of comments here, and I'm going to paraphrase some of them on our question of have you seen ads for casinos? And yes, Maryland Live, I have not seen any specific for women that I can think of. Yes, on billboards, and we've got a few. Certainly, women holding wads of money and smiling. Yes, I've seen ads with spas. I've seen ads promoting girls with a girls' getaway at gambling destinations. Seen ads at Rivers Casino. Resorts in Delaware are advertising. And a few say that they have not seen any ads as yet.
Okay, we had some good answers there. Thank you for your participation, and thanks, Donna, for reading those off. All right, so before we move on, I didn't have pictures of these ads, but I do watch the news in the morning often before I go to work. And you may have seen the Maryland Lottery's also doing some ads that I think appeal to women because they always kind of draw my attention in. But have you seen the Willy Wonka ads with the woman driving and then she looks next to her at the guy and he's green, like the Willy Wonka kind of green guy. And then she looks over and he's not anymore. And then of course, encourages her to go buy that scratch off ticket. So that's one ad I've seen. And then I've seen one, and I can't tell you what the product is, but it's this beautiful African American lady, and she's a reporter, and her hair is blowing in her face as she's talking, and she's trying to do something with the lottery, but I couldn't remember what it was. I guess I just kind of noticed her hair blowing in the wind. But anyway, lottery has a lot of ads, and their ads are really good, but you can obviously, women can gamble, so they do target women with the ads. So let's take a look at what you as either healthcare professionals or behavioral healthcare professionals or a family member can do to support the women in your life, just around safe gambling practices and also, to prevent risky gambling. So the center, we are big on promoting safe gambling tips. So we definitely want people to set limits on time and money. And we want people to not think it's gambling as a way to make money, but as just fun and entertainment. And also to balance leisure activities and, just promote wellness among women and all our population. And we want to balance on everything we do, not just gambling, but all of our activities and hobbies. And then if gambling behaviors are worrying somebody and they're not having fun anymore, then that's probably an indicator they need to cut back. And then having a plan of what to do with winnings or losses can help, or even keeping a spreadsheet of winnings and losses just to see how much money is going into gambling activities and how much you're getting or not getting in return. That's kind of a wake-up call a lot of times. And then if someone wins a big pot of money, what do they do with it? Are they able to control it and just stop right there, and then they keep playing until they lose all that money again? So that's some questions to ask. And then we encourage people not to borrow money to gamble, and then also not to use money that is for basic needs, such as your mortgage or your rent or food, because in that case, that would definitely cause stress on the family. And in general, talking about gambling is like starting a conversation about any kind of difficult subject, as if you were going to talk to somebody even about, alcohol or drugs. And it's important to be calm and to choose the right time to talk to somebody. And you want to come to the person with concern and in a nice and calm manner. And then just be specific about the behaviors that you've seen. So if you're concerned about lottery tickets, that have been purchased, or you've seen an escalation in the amount of gambling activities that you've seen, just kind of lay that out and tell the person, this is what I've seen. And then you want to listen non-judgmentally and let the person respond back. And then based on what they say, if you think it's really a problem, then just know there are resources available. There's counseling and also the helpline. So we just want people to know it's not an easy conversation, but we encourage you to have the conversation. And quickly, I just wanted to cover the center's peer recovery support specialist program. So if you are in a different county or in Baltimore City, different regions across the state, we do have peers that work in the different areas. And these are people with lived experience with problem gambling. So they are in recovery themselves from problem gambling. And they're able to help people to access resources and treatment if they are in need. And as for our other resources, we do have our 1-800-GAMBLER helpline. HelpMyGamblingProblem.org is our website for help seekers. And then we have no-cost treatment here in the state of Maryland. So people that are in need of treatment are able to get that treatment at no cost to them. And we do have, or the Behavioral Health Administration is able to reimburse the counselors that provide those services. And then I already spoke about the peer recovery support specialists. You can access them through the 1-800-GAMBLER helpline. And then we also have the Maryland Coalition of Families who support the family members of problem gamblers. And they're able to provide that support for those who have a loved one with a gambling problem. And then also we have the voluntary exclusion program on here. If you have questions about that, you can contact Jasmine Countess at the Maryland Lottery. She runs that program. And again, it can be a useful tool for people that are trying to stop or control their gambling behaviors, either at a casino, bingo hall, or lottery. And then just talk, if you have a mental health counselor or a substance abuse counselor, just can have the conversation with them about gambling problems as well. And some of the outside resources, there's Gamblers Anonymous, which was, already mentioned and many people are familiar with. And they are doing their meetings by phone right now during the COVID pandemic. And there's Gam-Anon as well. And they're also still doing meetings during the COVID pandemic. And then if you want to go to a local meeting of Gamblers Anonymous, or somebody would like to go to a local meeting, I believe these meetings are conducted on Zoom virtually. So that's a website where you can access a schedule for those Gamblers Anonymous meetings. And then obviously if someone's in crisis, you want them to call 211 and get the help for the crisis they need. All right, so we have one more chat question for you. Do you know of other resources for women who have a gambling problem, or other resources for women in general that may need help with resources? And Donna, do we have any other questions at this time?
We don't have any other questions at this time, Heather, but I do see our attendees are typing in some more information.
Okay. Thank you for your participation.
Heather, we have a comment coming in. I think South Shore in Cransville used to hold in-person GA. That's Brian. And we might direct also everyone to our help seeker website, helpmygamblingproblem.org, that also lists an interactive map with GA. And now that's linked also to remote, but just a reminder that you can find that information on our website.
Great. Okay. I guess we'll move on. Thank you everybody for your answers. We appreciate it. Okay, now we're just going to quickly cover how to prevent gambling problems among women, just to wrap it up here. So there was some information in the research about what to do to prevent problem gambling. Basically, there's a lack of research on women's gambling behaviors. So those that are doing research, it would be better, to make this an emphasis and start to look at the differences between women and men's behaviors, because a bulk of the research has been done on men. So just to make that a priority. And then to incorporate women's gambling into problem gambling prevention policy. So again, collect like gender specific data and look at different risk factors and contributing factors to problems, just to study the data to see how we can help prevent problem gambling behaviors among women, and to really look at public awareness and education for women, and target what we're finding in the data about women's problem gambling behavior, and put that out, in our public awareness campaigns and our education campaigns. Also work with community leaders and at-risk communities to provide the education. So if we do notice, our minority populations of women are more likely to have gambling problems, work with those community leaders and at-risk communities to get the messages out to the women in need. Also, we always need to be culturally sensitive. So if a program is designed, we need to make sure it fits with the culture of women and that it is getting the messages across in a culturally competent way. And we know that women prefer types of gambling activities like, bingo, slots, and online. So we can tailor some of the messages towards the preferred types of gambling for women and just talk about safe gambling practices for those type of gambling activities. And also, we don't want to forget screening. So we want to encourage women to be screened for problem gambling behaviors. And also, this is touched on before, but just make sure we're looking at the overall wellness of the women we serve or the women that we love, and make sure they are getting the time they need to take care of themselves and to, cope with any kind of stress they have in a positive way. And then if women need it, just encourage them to seek treatment. As I said, the treatment is no cost here in Maryland, so it wouldn't be an issue of being able to pay for the treatment. And just to put a shout out to May is Mental Health Month, and we do currently have a toolkit for May Mental Health Month, and it has a lot of ideas for prevention and public awareness activities you can do to promote Mental Health Month. And some of the things that we have inside the guide are definitely refer to your local health departments and your local mental health agencies for resources to help women and families. They often have really good programming that will help our women and families on a local level. You can also go to the mhascreening.org. It's the Mental Health Association. They have a mental health screening tool that can be used online just to see if people might be at risk for a mental health problem. And then we also have something similar for problem gambling. So you can go to our website and do a problem gambling self-assessment. Also, we encourage you to put awareness and prevention messaging on your website. If you need help with that, you can contact me or you can contact Donna Gaspar, our communications manager. We'd be glad to already give you pre-designed messaging and any type of thing that you would like for your website. Flyers we also have available to post in your office, or you can email them out virtually or put them in your e-newsletters. And then reach out to our peer recovery support specialists. And again, they can be reached through the helpline 1-800-GAMBLER. Also, if you're into social media or your organization is, we'd be glad to give you social media posts. They're found in the Center's May Mental Health Guide, but also if you reach out to us, we can tailor them for your organization. We just did some for the family tree in Baltimore. So it was tailored around child maltreatment and how gambling connects with that, and they put it on our website, on their website. So that was really nice to promote it and to collaborate on that issue together. Also, continue to watch the free webinars we have and get your CEUs that way, and will increase your knowledge of gambling and problem gambling so you can be a community advocate and always be aware that problem gambling can possibly be a risky behavior. Also, integrate problem gambling into any resources that you may be aware of, such as student assistance programs or employee assistance programs. So if you have an HR department, so workplace wellness, and just including problem gambling as one of the possible resources and a list of resources that people can obtain through their employer if they're facing addiction or mental health problems. And also, we'd love to be included in any local resource guides. Some of them I know are on on organizational websites, or they can also be found just in the counties. So we'd love to be included in those. And also just include gambling in the discussion with alcohol, tobacco, and drugs, as it is, you know, an addiction very similar to substance misuse. And that is all I have for today. I believe we have about 7 minutes for questions. Hoping someone out there has a good question for me. Do we have any questions, Donna?
Heather, we do have one question coming in. And we did get another really great comment, by the way, for additional resources for women support, and that was TrueLink Financial. One of our attendees said that is a great resource to give to people if they need additional financial support and guidance. And
Great.
Our question coming in today, Heather, from Amanda is, are there any data regarding recidivism regarding men versus women who are in recovery? Is it worse or better for women?
Wow, that's a great question. I mean, I do know we had one study done here at UNB, but it was all men. And we do know that the data shows that people that are in treatment are more likely to be problem gamblers or to have that co-occurring disorder. So it's better to treat both, or, you know, to definitely treat the gambling problem. But I don't think that we've done any studies here at the university on the women. But I will definitely look into that. And if we have your information, Amanda, we can get back to you if I see anything on that. But that's a good question.
Those are all the questions and comments we have right now, Heather.
Okay. Well, I guess we'll be finishing up a couple minutes early, but I thank everyone for joining. And here's my contact information up on the screen. I'd be glad to hear from you if you know any ways we can collaborate with your organization. And if you have any data requests, we'll try to get those to you. But it's always a pleasure to do these webinars, and I hope that you gain a lot of good information from today's webinar. So thank you everyone for attending, and I hope you all have a great weekend. So thank you so much for coming.